this is Lisa. So I filmed this video several months ago. And I mean, several months ago, I mean like almost like 7 months ago. But I filmed it during a time when I was really sick and I just never got around to editing it. And so it's kind of been in my video vault for a while. So anyways, just take in mind, I maybe look a little different. Things are a little different. Definitely don't have a scar on my head. And yeah, enjoy. Hi, I'm Lisa and welcome back to my Fat React series. I'm going to be taking a look at different aspects of health culture, including the fat acceptance community, the fitness community, as well as popular health and beauty trends. So if you've been watching my channel for a while, then you know that I have like the holy trinity of like really hard to diagnose diseases. I have PCOS, hypothyroidism, and hypermobile ehlers-danlos syndrome. I know. Yes, I have all three of these really weird diseases. It took years to get diagnosed with all of them. Something we'll talk about in this video. Especially since a lot of these like illnesses tend to be, I don't want to say overdiagnosed, but people tend to claim that they have these illnesses and they don't actually. There's a lot of Munchausen's fakers out there. And yes, I have actual diagnoses from actual doctors for all three of these things. And you probably heard of Dr. Mike before. I mean, he's a really, really famous YouTuber. He's born in 1989, just like me, just like Taylor Swift. I'm really obsessed with that year. I kind of like to take a look at all the people who were born in 1989 and just kind of like compare us. I always like look at them and like, oh, they're so much more successful than I am. You know, we're just all peak millennials trying to make it out of here in the world. So yeah, let's kind of check out what Dr. Mike has to say about it all. And as you may know, I'm really tired. I usually am, especially with the vitamin B12 deficiency I'm dealing with right now. So we're just gonna kind of wing it. Okay, let's get started.
When you hear hoofbeats, think horses, not zebras. This is a saying that's instilled in your mind as a medical student by your senior physicians.
Yeah, I have no doubt that's the case because it took about, let's start with the first one. I was diagnosed with PCOS when I was 25. It was right after my brother's wedding in early 2015 because he got married in 2014. And I've been having symptoms of PCOS since I was literally 12 years old. And I would go to the doctor. I remember going to the doctor at 15, 16, my mom advocating for me and saying, there is something wrong with my daughter. Like, she has all these symptoms. And the doctor would be like, oh, it just takes a while for the period to normalize. Oh, you're not really having as bad as symptoms or as, bad of bleeding as you say you're having. It's just, I was constantly dismissed again and again and again. Part of the reason for that, I think, was having military health insurance. It's not the best. And that problem was, I think, people just have a tendency to want to dismiss their patients. I don't think it's all about, like, people always say, women have it hard in the medical system. Maybe that's true. Who am I to say? I just know my own experience. It's been pretty freaking hard. But I do think, considering I had literally every single symptom by the time I was diagnosed and still being dismissed until they could actually see the cysts on my ovaries, that was a pretty terrible thing to go through. And it took several more years after that to find a medication that actually worked for treating it. And then let's see, I was diagnosed with hypothyroidism. I believe when I was almost 30, I was like 29. It was like early 2019, I want to say. But at this point, I'd lost 85 pounds. I had since gained it back, and then I now have lost nearly 60. I'm like 59.5 pounds right now. I'm like so close. And I was doing really well, but I was just so tired. And the doctor had taken away all my medication because my old doctor had gone like, their like practice had gone bankrupt, which is the whole thing. And then they didn't have access to my files because the American like file system for medical records is like stupid. And so it took a while for them to get my files. And like by that point they were like, well, we don't actually believe that you have PCOS. We don't believe you have all these things. And so in the meantime, I gained back a lot of weight because I wasn't on the appropriate medications that were treating like that illness. And I just was crying at the doctor and they're like, well, you're just like, I didn't say hysterical, but I knew they wanted to say it. Like, you're just hysterical. You need to go on anti-anxiety medication and anti-depression medication, blah, blah, blah. And I was like, no, I'm not going to go on those medications. I'm telling you what's wrong with me. I'm tired. And so finally this young, like, student doctor, I guess she was, like, doing her residency or internship or something. I think probably internship. She was like, well, how about we look for hypothyroidism? And the doctor was like, whatever. He was a terrible doctor, by the way. Terrible. And so she tested for hypothyroidism, and she was like, Charlotte the Chocolate Factory. She was so excited to tell me I had hypothyroidism and that this would cure a lot of my energy issues. I mean, that took a while, and I eventually did start to feel better, and I wasn't able to lose the weight because COVID started soon after that next year, and I was still getting through grad school, and then I couldn't go to the gym, and that was just a really hard time, and I'm glad I'm finally losing weight again now. Sorry, long ramble rant. But one thing that kept happening is I kept getting really badly injured. That was another reason why I was struggling to work out. And I was talking to my friend, and then she just suggested to me, she's like, have you ever thought you had like Ehlers-danlos syndrome? Like, what in the world is that? And she's like, well, you like things with stretchy skin and bendy joints, and you're like easily injured, blah, blah, blah. And I like looked it up, and I had like every single symptom. And for the time she told me that, to a time of seeing a specialist, was only about 6 weeks. And I saw the specialist within 5 minutes was like, oh yeah, you got that, like bad. and I also, like, turns out I got it from my dad, who's adopted, so he didn't know he had it. And it explained a lot of things in his life, like why he had so many unexplained hernias and why he had all these other issues. And it just kind of like made our lives make sense. And like I said, that was when I was 31. It takes like an average of like 23 years to get diagnosed with hypermobile Ehlers-Danlos syndrome. And I can remember having my first symptoms when I was like 8 years old, and I was trying to run and feeling this intense pain in my joints at 8 years old. 8-year-olds should not be feeling intense joint pain. And telling my parents, like, this really hurts, and them just, like, ignoring me. Because, like, nobody considers that this could be true, right? And what happened exactly 23 years later? Diagnosed with the disease, right? Yeah. Anyways, let's continue watching.
The way we're trained to do this is to create a differential diagnosis. This is a list of illnesses ranked in order from most probable to least probable, with the exception of a disease that can harm you now. For example, if you come into my office as a 21-year-old male complaining of some mid-sternal chest pain, I'm not going to assume you have a heart attack. It's not likely that you're having a heart attack, but I best rule it out because it can be life-threatening.
That's actually one of the ways I got diagnosed with asthma. I was having like an asthma attack, and I thought I was having like a heart attack. I know that sounds crazy, but it was like really bad, like chest tightness, and I couldn't breathe. And my parents took me to the emergency room. They're like, no, you got asthma. Your heart's fine. So that is something like, to be fair, asthma attacks can be like really bad. So I'm glad that was something to be taken care of. Before then, they told me I'd had like some other, like there's two like types of asthma. Like there's like cough variant asthma, and then there's like regular asthma. And cough variant can like evolve into regular. And I think that was like what pushed me over the edge of like, yeah, you don't have cough variant asthma. You have like just regular run-of-the-mill, gonna kill you asthma. Anyways.
All that being said, I admit that we in the medical community forget about our zebras. Our patients with these rare, chronic, incurable illnesses that go undiagnosed for decades at a time.
Decades is right, incurable is right. It sucks. And I'm often one of those people where I'm like in denial about being, I don't even want to say the word, starts with a D, something. I get it that there's some things I just cannot do because of one of these diseases in particular. I often forget this, and I try to do things anyways, and then I end up getting hurt, and it's just the whole thing, and it's a cycle repeats over again. I still find myself being in denial a lot, or I'll just push myself too hard. Because I'm just like, well, you know what? My body can take it, and I really can't.
So today I want to cover 3 rare chronic incurable illnesses: PCOS, Ehlers-Danlos syndrome, and thyroid disease, in order to have an honest discussion about these patients who are truly suffering as a result of misdiagnoses.
You hear that? Dr. Mike says I am truly suffering. And it's true. I felt like I was suffering, but people would always tell me, like, you just have like a really positive attitude, Lisa. Like, you can't really just be in as much pain as you say you are. And I'm like, I really was. Just because I'm like a sunshine person does not mean I'm not in pain. It's, yeah. Anyways. I felt like that was one of the reasons why my doctors would often dismiss me, is because it's like, yeah, how are you feeling on a pain scale of 1 to 10 today? I'm like, yeah, like about a 7. I feel like a 7 today. And they're like, really? You feel like a 7? It reminds me of this one time I was at the physical therapist, like shortly after my Ehlers-Danlos syndrome diagnoses, and I did not like this guy. Like this guy, I'm sorry, some people just not be in the medical industry. And I was talking to him, and he was saying, on a scale from 1 to 10, what is your pain level today? 1 being like no pain and 10 being like hospital. And I was like, level 10 isn't always hospital. And he was like, yes, it is. Level 10 is always, you need to go to the hospital right now. And I'm like, sir, I've had 45 kidney stones. If I went to the hospital for every single level 10 pain event I've had, I would have endless amounts of medical bills. Sometimes you just gotta tough it out at home. If you know you're not gonna die from a kidney stone, you need to like wait it out on your bathroom floor, then that's what you're gonna do to avoid the $6,000 like emergency room bill. Just the way it is. But no, he insisted. He just like explained to me my own pain levels, and I know what level 10 pain is. It's called a tiny rock in your ureter. You know, it's funny because my mom did not take my kidney stone pain seriously for the longest time until she got a kidney stone, and then she like apologized to me. She's like, Lisa, I had no idea. That's what that felt like. And she told me that it was worse than childbirth for her. Anyways.
Patient number 1 is a 28-year-old female that comes in with the chief complaint of acne, or breakouts. After a brief history and physical exam, the doctor diagnoses the patient with acne vulgaris. However, a crucial part of the history was missed. Is the patient having normal menstrual cycles? And is the patient experiencing any hair growth that is unusual for them?
This is another thing. So, like, I did not appear to have unusual hair growth. That did not start popping up until I was about 24. Because you have to understand something about me. I'm kind of like a dolphin. I appear hairless to most people. And so when I started having irregular hair growth, it looked like normal hair growth on the average person. Because I have very, very fine, thin, like short blonde hair on my body. And so it can be like where I don't have to shave my legs for like weeks at a time because the hair is just not noticeable. But I started to notice hair when I was like 23, 24, and it was coming in dark, and I got really concerned because I'm like, what is going on, right? It was coming in on my arms, it was coming on my stomach. I wasn't getting anything like face-wise, thank goodness, but I was getting like the other unusual areas. And that was one of the things that I showed like a dermatologist, and it was the dermatologist of all people who looked at my acne. She looked at this like yeast infection like on my scalp, and she looked at the hair, and she was like, I think you have PCOS. Like, didn't you say you have irregular menstrual cycles? And I'm like, yes. And yeah, so she was the one who gave me the referral to go see someone to give me like an internal ultrasound and everything. And they're the ones who diagnosed me in Japan. It was a dermatologist in the US, but I took the referral to Japan with me because that's where I was living at the time. So yeah, I was in Japan to diagnose me. And then after I started medication, the hair stuff like went away, and it's been fine ever since. But all the other doctors were like, no, that's normal hair. And I'm like, no, it's not. It's like same thing with my hands. Like, you look at my hands, they're like itty bitty, right? Like next to my face. Like, they look huge up here because of like the perspective, but they have like tiny little, like thin, long finger hands. When my hands are swollen, they look like normal hands. They look like a normal sized hand. But to me, it's like I can tell when my fingers are swollen. And then one time I had this allergic reaction, my hand blew up to me. And the doctor's like, your hand's fine. I'm like, no, it's not. It's swollen and it hurts. Yeah. So sometimes you have to like listen to the patient and know what their normal is. That's something we have to take into account as like a speech pathologist. Like when my father was in the hospital, he had severe dehydration due to pneumonia, and he had to be hospitalized due to like neurological symptoms. And the doctor was like, well, you're speaking really well. You seem just fine neurologically. And I was like, hold on. No. He is not fine neurologically. He's just very intelligent. So when my father was having neurological symptoms that were impacting his speech, he just appeared normal, but really he was having issues with his speech. It's just, it did not appear like issue. And that's something that we actually talk about in the classes I took in grad school for patients. So this is like a dehydration-induced dementia. And we have to take into account, like, you know, somebody who's a lawyer, for example, may appear to have normal speech, but is it normal for them? If they've had a head injury, if they're having dementia symptoms, if they've had a stroke, you have to take into account somebody else's normal. And doctors often would not take into account my normal. They would just dismiss me.
The reason we need to ask these two questions is because of a condition known as polycystic ovary syndrome. PCOS is a hormonal reproductive condition that is estimated to affect 8 to 20% of reproductive age women across the globe.
This is also a weird thing. Like, 8 to 20% is a huge number. Like, we talk about this like a rare, hard to diagnose disease. It's not actually that rare. It's just like 1 out of 5 women is common. And we don't really talk about why this is happening. Like, why do so many women have this issue. It's kind of weird, right? My personal opinion, based on some of the research that I've read and just from my general rants about inflammation, I think it's inflammation induced via diet. And I'm hoping that the longer on the diet that I am and the more weight that I lose to get my inflammation levels down, that the fewer symptoms I'll have from PCOS.
So it's technically not even a zebra, yet we treat it as such. Up to 50% of women say it takes seeing 3 different doctors before the diagnosis is finally made.
Okay, let's think about this. So I saw that doctor when I was 15, and I saw this doctor when I was in college, saw the dermatologist, and then she referred me to the doctor that actually diagnosed me. So that was about 3 doctors. Yeah, that makes sense.
The diagnosis is made by meeting 2 of the 3 Rotterdam criteria. 1 being infrequent or missed periods. Some patients don't have a menstrual cycle 4 to 6 months at a time. 2nd is having an increase in male hormones, whether we measure it in the bloodstream or through clinical features like male pattern facial hair growth. And 3, seeing polycystic ovaries on ultrasound.
So yeah, I had the increased male hormones. That was how they knew, because like I said, they weren't taking my other male hair growth symptoms seriously, but my male hormones, they didn't call them the androgynous hormones, what they were calling them. It was some, I don't know, because take in mind, they were telling me these things in Japanese, and so sometimes I'm not sure if if it was translated to me correctly, or if I understood it correctly at the time. So yeah, I had the polycystic ovaries, and I had the male hormones, and another thing that I have, which was kind of weird with polycystic ovarian syndrome, is that I did sometimes skip periods or have late periods. I'd have 6 weeks in between periods, and doctors would just always think I was pregnant, and I wasn't. What I would often have is I would have periods that lasted sometimes up to 2 weeks at a time. I would sometimes have periods that I had twice in a month, because basically how PCOS works is that there's a miscommunication between what controls the hormones in your brain and what controls the hormones in your ovaries, and the signal just kind of gets lost and mixed up, and it doesn't arrive on time. But that can also mean that it can be sent too early and arrive early. Anyways.
One of the most important reasons as to why we need to identify PCOS early on is because of the metabolic syndrome side effects. What I'm talking about is increased insulin resistance, overall weight, and high cholesterol scores.
So I didn't have high cholesterol. I just have chronically, genetically low cholesterol in general. But I did have insulin resistance. I don't have it anymore. I was technically at one point type 2 diabetes just because of the PCOS. But once I started being treated for the PCOS, the type 2 qualifications went away. It never really was qualified as type 2 simply because it was caused by PCOS. But I did have insulin resistance. I don't have it anymore. My insulin's actually really good. And like I said, it was just caused by the PCOS. And the medications that I was on, I think I've told this before. At first, they wanted to put me on regular progesterone, but they were really afraid that it would just increase the secondary side effects of PCOS. So they decided to put me on synthetic progesterone, which they claimed would help better with the secondary side effects. So I did that, and it definitely did, but it did not help with the menstrual cycle. It did, however, help with the insulin resistance and the hair and the acne a little bit, not a lot. I got back to the US and I was I don't want to do this progesterone anymore. It's not working. The menstrual cycles are things that I am most concerned about, because I was having issues. I passed out at work. I was having that kind of thing. I passed out at work multiple times. One time I was at my desk and I just I passed out on the desk. I thought I fell asleep, and it's Japan, so I didn't get in trouble. They were just you work so hard, Lisa. Good job. It was that kind of stuff. And yeah, so it was really affecting my life, and it was also affecting my life. And don't listen to this if you don't want to hear any gory details. But when you bleed that much, it really affects your ability to do anything physically. I was having trouble getting through teaching a 1-hour class in a middle school, simply because there was nothing I could do to stop the bleeding. And I would have to go home several times during the day to change my clothing. It was that bad.
These can put the patient at direct risk for developing heart disease, amongst other problems. We've also seen by controlling these factors, either by giving medications like metformin, making lifestyle changes like dieting and exercising, can help control the symptoms of PCOS and in general improve risk factors.
Oh, that's what it was. Yeah. So I was on, after progesterone, I went to the doctor and she put me on metformin. Did not work at all. It actually made things worse. And so, eventually, we had to settle on birth control. It's the only thing that's ever worked for me. I didn't want to be on birth control. It was a last resort. I hope I can get off it in a couple of years once my weight goes down, once the inflammation goes down. We'll just have to see.
Because patients are not going through their regular menstrual cycles and they're not ovulating regularly, they have problems with fertility and they're not able to get pregnant as easily as someone who doesn't have PCOS.
Yeah, actually, one of my endocrinologists told me that I would likely have to do IVF if I ever wanted to get pregnant. I hope that's not the case, but she said to know that was a possibility, save up money if you want to have a kid kind of thing. So yeah, I got that looked forward to.
Patient number 2 is a 48-year-old female that comes in with a chief complaint of fatigue, weight gain, and muscle aches. After a brief history and physical exam, the doctor determines that the patient must be a bit dysthymic, depressed even.
I love how he's depressed even. It always comes back to, it's just all in your head, isn't it? You're not actually feeling like crap. You're just a little anxious. You're just a little depressed. You need to go on some depression medication. Story of my life. Never went on it. And honestly, I know so many friends who have gone on it and probably should not have gone on it. And it's just because their doctors did not listen to them. Surprise.
Perhaps perimenopausal based on her age. Recommends a few lifestyle modifications and cognitive behavioral therapy for her mental state and sends her on her way with a follow-up in a few months. But something crucial was missed. Thyroid disease was not discussed. And again, folks, thyroid disorders are not true zebras.
Okay, I just love how he was the doctor said, oh, you're just going through menopause. It's like perimenopause stuff, right? No, you have freaking thyroid disease. God.
The thyroid is a hormone-producing gland that regulates the body's metabolism. It basically changes the way that our body interacts with nutrients and oxygen, and it affects our activity levels. So if you don't have enough thyroid hormone, think about the body slowing down, depression, weight gain, cholesterol going up.
Okay, so I think I've told this before, but getting my hypothyroid diagnosis, I don't know why I'm laughing, was a whole thing. So I was tested when I was I want to say 22. And this is before a lot of the records were online. I am 34, so it's been 12 years. I was tested when I was 22. I was tested again, as we know, at 29. And the doctor was looking at my old test results, because by then they had been uploaded into the system, in the network, whatever. And she was like, your thyroid numbers from years ago are really low. And I was like, what do you mean? And she's like, why weren't you on medication all those years ago? Why are you just getting medication now? And I'm like, and I remember that test too. And I was like, well, they told me my thyroid was fine. And the endocrinologist was like, no, it's not. Oh my God. They had misread the test. And I don't know if it was that kind of test that says low on it, like normal or low or high, whatever. I know they all do that now, but I think it must have been I think they do that now because of stuff like this, where they misread the scales. And the endocrinologist was like, oh my God, you should have been on this thyroid medication for years. And from that time, I had that first test that was not diagnosed correctly to the one where I was finally diagnosed and treated. I had gained over 150 pounds. And I had PCOS in this time too. And I was being constantly injured from the EDS I didn't know I had. And it's just wow, all these three things really compounded to make sure that I just gained the most weight possible. Like I said, fortunately, I'm losing a lot of it now. I'm almost 60 pounds lost from just diet and exercise and a very special diet that I'm on. But geez, it's did I even have to gain all this weight? It really makes you wonder.
Most thyroid diseases are lifelong conditions without a technical cure, but they can be managed with medical, surgical, or other interventions. Some interesting statistics about thyroid disease: an estimated 20 million Americans have some form of it. Up to 60% of those with the disease are unaware of their condition, and women are 5 to 8 times more likely than men to have thyroid problems. And we don't even know why.
Yeah, why is that? Why do all these women have thyroid issues? It is kind of weird. I do wonder if it's the fact that women have greater change of hormones throughout the month, that we're just more prone to having hormonal disorders, whereas men tend to be steadier when it comes to hormonal changes. That's something to consider.
Patient number 3 is a 35-year-old male that comes in with a chief complaint of easy bruisability. The doctor does a good history and physical exam and wants to rule out bleeding disorders. Does a whole set of blood tests only to find out that they're all negative.
I do bruise like a peach, I will say that. Yeah, I'm constantly walking into things too. Like, I don't know what it is. Well, I guess the B12 deficiency is probably one reason why I'm so clumsy, along with the hypermobile ehlers-danlos syndrome. But yeah, just that clumsiness does cause me to, like, just constantly injure myself.
So they reassure the patient. Patient goes home without an answer. What should have been asked are questions about hypermobile joints, accidents, loose skin, and family history. Why? Ehlers-Danlos syndrome. It's one of those zebras that we always have to keep in the back of our minds.
Okay, so let's talk about the EDS thing. So, as I said, my friend had pointed out to me, this is because we were hanging out on New Year's Eve, and I was like, hey, check out my really cool joint disorder. And we were like doing it on the computer because obviously it was COVID time. And I was showing her how I could like do all this weird stuff with my hand. I'll show you in a second. Or could like do that. I know it's gross. People probably don't want to look at that. That was just like one example. That one's not even that bad, but you can see I can turn my thumb around. I can like take my thumb and can like, it's like hard as like I can like basically dislocate it, turn it backwards. And that was like the first indicator to her because she's been tested for everything. She's like really ill. And she was like, yeah, here's like this clinical checklist, Lisa. Maybe take this to your doctor and find out. And it's like, one of the things on it, it's like, can you do the thing where you like pull your thumb back to your arm? And like, yeah, that's like really easy for me. Like, does your pinky go back mine doesn't go back that far, but it goes back like apparently enough. Like, is your skin stretchy? Like, this is my cute Halloween sweater. I see. Anyways, yeah, I'm like, my skin is like, it's really hard to see, but it's like, my skin can pull like really far away from my arm, and probably thinking like, oh, it's just loose skin because you're fat. Like, no. There's like different like hyperextensibility of skin and hypoextensibility. Like, one is loose skin and the other one is like your skin snaps back into place, no problem. Like, that is not how loose skin works with being fat. So you can see like, it's really gross. It comes off and it's like really bad on my chest too. Like, I'm not going to show you that, but like my skin can come off like my chest really far. My knees kind of like go backwards. I don't know, like, my hands, those things. Yeah. Anyways, lots of party tricks.
EDS is a genetic condition that affects the connective tissues of our body. This can include skin, blood vessels, bone, and even organs. Now, there's 13 different subtypes of EDS, but all of them have one thing in common, and that's hypermobility.
Yeah, thanks, Dad.
It's really important when you're seeing these group of symptoms arise in a patient that you ask about hypermobility so it doesn't go overlooked. In order to make the diagnosis, we use a set of clinical criteria, genetic blood tests, imaging, and even skin biopsy at times to make sure that we are in fact treating the correct subtype of the disease.
I don't know if this is true. This is just what I've been told. But the doctor said I didn't need to get genetic testing because there's kind of like a long wait list for genetic testing, especially if it's like non-life threatening. And if they don't suspect the type of EDS where that can cause you like heart problems, they're not gonna like put you first in line. Because when you have hypermobile ehlers-danlos syndrome, the one that technically most closely resembles that is classical EDS, which can be genetically tested for. So unless you have classical symptoms, which means like more skin breaking and like really like stretchy skin, they're not going to really recommend you for genetic testing. So I still have the option of pursuing that. It's just I have all the clinical symptoms of hypermobile ehlers-danlos, and I was diagnosed by a specialist who's like an actual doctor. So at this time, I don't really need to do that. But like, I will say my dad kind of has more of the classical symptoms. So it is something I'm thinking of looking into, just to like rule it out. Like, you could just have really severe skin issues for all I know. They are actually, though, working on figuring out how to genetically test for hypermobile ehlers-danlos syndrome. It's so weird. I just happened to have moved to South Carolina right after I was diagnosed. And MUSC, which is the Medical University of South Carolina, is actually doing a research study on diagnosing hypermobile ehlers-danlos syndrome genetically by genetic testing. And I did submit a sample to that, so hopefully one day.
When we're talking about treatments, we're largely focusing on physical therapy, surgery to fix the injured joints, and finally drugs and medications that can help a patient with the symptoms of EDS.
Yeah, so about those medications, man. Yeah, I am on a lot of medications, only a few for the EDS, but one of them I finally got, which has helped a lot, is I was having such terrible muscle cramps, because what ends up happening is your joints are so unstable that your muscles have to like overwork to keep the joints from just like going out of place. And so that causes a lot of like really bad like muscle cramps and just generalized pain. And so one of the things that's really helped me is doctor prescribed me like a muscle relaxer that I take at night before I go to bed, because what would happen was I would, I can handle the pain during the day. Like that's fine. I don't mind being awake and in pain. I know it's annoying for some people. I just don't want to be trying to rest and be in pain. That's the worst thing. So, thankfully I have a good doctor, and I have a very, very, very low dosage of like muscle relaxant that I take. And only at night when I go to sleep. And that helps because before I would wake up in the middle of the night and I would have like severe cramps and I couldn't go back to sleep because the cramps were so bad. I'm not talking about like Charlie horse cramps. I mean like back cramps and shoulder cramps and arm cramps and hip, like I don't know how to describe it, like hip cramps. Yeah, something like that. Just from laying in a position and having your muscles be like stressed out and then cool down when you sleep, and it's a whole thing. It's terrible. It's not fun. Okay, yeah. So I really enjoy that. I like how he's bringing attention to these 3 diseases that I just happen to have. Maybe you should talk about vitamin B12 deficiency and why it goes unnoticed. Especially since there was, like, in my case, it was being caused by, like, a medication reaction or, like, medication stopping me from absorbing B12. I had no idea, right? I literally had no idea. Anyways, yeah. Thank you, Dr. Mike. Thank you, fellow 1989 baby. Us peak millennials got to stick together, you know. I mean, you're way more successful than me, but maybe one day, right? Yeah. Anyways, thanks for joining me here tonight, and I'll talk to you guys later. Bye.